just to get into like, left ZOA, like getting our left rib cage to drop, getting our diaphragm to relax, getting that zone of that position. If you can't get into your left ribs, you can't get into your left side, like your left hip, right? So a lot of times I'll be trying to get bull under, because I think or I thought I had bell down, and I really didn't. And I just go and banging your head against the wall. Why is this person getting under? It's because you're really not getting the mobility that you really needed up here, and it hasn't like really integrated a lot. So sometimes you need to kind of reverse back up the list to like, where's left ZOA? Am I getting this? Am I really getting it? And kind of back up a little bit. Because like I said, if you can't get in your left rib, you can't get in your left hip. And there's also some frontal plane stuff that's not happening, and you can't really get your right glute to fire. Just to kind of to come back to the pelvis, when you're forward and externally rotated, you're oriented to the right. And so your leg is not going to want to be in, you're going to externally rotate here to kind of compensate for that. So then putting your leg out of position, knee, foot, dysfunction, things like that. So when I get like a left plantar fasciitis, ooh, good. I kind of know what to do here. Or you're just not getting out of your right side and into your left, which causes right side issues.
On top of that too, you're a lot of times looking at the symptomatology, and what I talk to people all the time, is this your symptom? It may be a right plantar fasciitis, but you might be treating it the exact same, because your left plantar fascia, maybe it's because I'm pronating, I don't have motion control, whatever it may be. My right plantar fascia might be because I have too much supination, I don't have midfoot mobility, but the whole factor is either way, I'm still right AFYR, not getting over. It's our body's way of compensating. We all compensate differently. We're, realistically, and like one of the courses I went to, unless you have abdominis inversus, you're going to be patterned in some fashion towards this, okay? But it may just present differently, and you may have different, but what the presentation usually is different compensations, I'm a top down, so a lot of my drivers are the fact I don't have a really good left visual field awareness, and so I can change my symptoms in my right calf by simply working on some activities that are looking far left, not turning my head, but getting into left visual field, and then all of a sudden my calf, quote unquote, tightness and cramp goes away on the right side. That's sometimes, as you go through this journey and process of doing it, and these guys will tell you the same, it can be frustrating because what am I doing? Because we have to appreciate that there's a lot of different things going on here. I mean, it could be molar interaction, it could be this, it could be the fact that because it doesn't matter what they're doing, you will find they're going to make some sort of changes for that person. It may not always be positive. They might start getting cramping and pain in other places. When you go through practicing this, always kind of reset and look at positioning mechanics, stuff like that, because it will get frustrating for you and the client, and it gets less frustrating for the client the more knowledge that you can share with them of what you're trying to accomplish.
Right. And what we're teaching here is kind of the basics of PRI, like left ZOA and pelvic positioning, myokinematics, getting into that left side. There's so much more to it. There's jaw interaction, there's cervical stuff, but just learning the basics, you're going to make changes. And like Greg said, sometimes negative, but a lot of times positive. Kind of using your PT skills you had before PRI they'll be more effective because things will stick better. Right, your changes will last. To talk about, go back to the myokin piece here, we talked about the external rotation and forward orientation of your left innominate. But then we've got a lot of people that we see where the ribs are jacked up, have no left ZOA, they're up on both sides, and they're forward on both. So, the adductor drop test is positive on both sides, very positive on both sides. So they're forward on both, and under every, and this is the PEC pattern, right? The posterior extensor chain pattern. And what we're trying to do initially is like, man, we need to clean this up first, right? Help unlock your pelvis a bit, and then get your pelvis kind of back in general, right? You're gonna still be like, once you get under, you're gonna start getting into that left AIC pattern. Under every PEC, there's a left AIC. Right? If you can start to get under, they're going to start to get into here.
So PEC is posterior eccentric chain, left AIC is left anterior inferior chain.
Right.
It's just a chain of muscles that group together that are creating kind of pattern that we're in. And it's confusing even still to me. Is it positioning? Is it pattern? Is it movement? I still get confused sometimes and have to refer back to, okay, left AFIR is a positioning, but it's also can be a movement. It's just being aware of that is
important. Yeah, it's like, right now you don't need to get in the weeds of what is left AIC. It's just, this is a left AIC pattern underneath, a PEC sometimes. So we need to get them out of a PEC. They're going to then most likely get into this left AIC pattern, and that's good. Like, you made a change, but now we need to start getting them into the left and get into that left AFIR to kind of get out of the left AIC pattern. Right, that's basically what we're trying to do. A lot of times we're trying to get them out of PEC, left AIC, and then try to get them doing this, right? General brass tacks without getting too far into the weeds. That's kind of what we are looking to do. But to even get into this stuff, we need to be like making sure this is down and there's some mobility there. So once we kind of get to that point, we're looking to, all right, what are the ingredients? Like, what are the muscles that we need to start activating to help get into the left AFIR position? And those three things, the big three, is the right glute max to help push us into the left side. And to help and get the left hamstring firing, so the left hamstring can pull us back on the left side and also internally rotate. And then our left adductor here to help kind of pull us into that left side as well and help internally rotate the left innominate.
And then left glute medius internally rotates the innominate.
Sure.
So one of the things that, when they go through the courses, it was opening for me. I mean, I've been practicing a long time. I said, oh yeah, the different fibers and the different directions of the glute medius, and the fact that glute medius does abduct, but it also turns that innominate in depending on the angle of your hip, right? And so that glute medius helps us get there. The adductor helps us get there. So the left side is pulling you over or pushing you into that side. But the right glute max, like Derek said, is actually just it's the ability to get out,
to push,
right, and get out. And if I don't set myself in gait sequencing where I don't push too much, I have to have a lot more activity over here. But then again, because I'm not pushing here, I don't set these muscles up for success, right? I'm already so open, and now I have to really kind of pull over.
Yeah, if Greg can't get into his medial arch on this side because he's still so far over here, he can't fire this to get over, right?
So I can't go, because think of and then that's the other thing about the glute max. You think about the fibers and what it does. It's actually kind of pulling us into that position.
Right. So there's push and pull, right? And right glute max is. In Myokin, they one thing I remember from Myokin is like, right glute max is the king. It's glute max for a reason. It's not glute insignificant. It's glute maximus, right? It's the king of the pelvis. So a lot of things, you can help a lot of things with just giving people a right glute. And the last thing here, left grounding, and I think Greg alluded to that, is just finding the left side. One of the first things I do with patients first day, I'll usually run them through some basic PRI, and then I'll say, hey, between now and your next visit, I really want you to focus on your left heel, and I'll teach them how to, just step back a little bit and find their weight through that left side. And I'll say, just do that. Pause when you're thinking about, hey, I went to PT the other day. I want you to think about your left heel. And usually they'll come back and say, I caught myself so much doing this. Right? So, so you're breaking the pattern. You see your pattern, and now we're breaking it and starting the path to getting into your left side. So just grounding and kind of neurologically recognizing this side. It's almost like, start writing with your left hand, right? And people understand righty-lefty. So, and it's not always about that at all, but people understand, like, it's awkward on my left.
Try brushing your teeth with your left hand.
Right.
And you're really, it's healthy for your brain. You're interrupting ruts. With our ability, again, stepping back, we need the ability to go right, left, right, left, right, left, right, left. And that's reciprocal movement pattern.
Yeah.
And as you're trying to learn to get into a new skill set, you're never going to get rid of the dominant pattern. It's always going to be there. There may be emotional stressors, there may be dehydration, metabolic, sitting too long, standing long, lifting too much, that are going to put us into our alpha dog that's going to want to pull us back there. And as Ron Hruskus said in the course, and he says, you can hear him say this before, we are trying to reduce the bias of our body going into activity. We want to be less biased, because the more biased we are, the more compensation we need.
And that just begets pain and issues. To kind of get into, I mean, there's not a lot of assessment, but I think we should go over like the left or the adductor drop test. Are you familiar with 90-90s? Are you doing those quite yet?
90-90 hip lift.
A little bit, but I feel like I don't use them with patients because they ask, why am I doing this? I'm like, because you need to, like, I don't have that.
You don't have the cell. You don't have
right,
the...
exactly. I'm just like, I know you should do it. I can't explain why we're doing it.
Right. And that...
And one of the things you're both are doing is like the kind of term I stole from Michael Mullen is we do neurological trickery, right? And that's what you kind of say. It's like, well, we want to kind of, so one of the things, like, when you lift something with a weight, you use your biceps, do you have to think about shutting that opposite muscle off? No, right? As soon as you turn that on, the opposite shuts off. Well, your back muscles are really tight. And if I turn on your hamstrings and I turn your stomach, I'm helping the opposite muscle shut off. You know how jacked up your back is? We're just trying to teach it to relax. And having that conversation about what tone is. Tone, everybody, I want to be toned. The problem is, I said, take your bicep, make a muscle, hold that for 24 hours. It's not going to feel good. That's what's going on with your back muscles. And keeping it general, so you're working on understanding that we're trying to reduce this overall tension thing. The issue, by the way.
No. Okay.
You sure?
We all got issues.
Yeah, I got issues.
Hold this leg. I say, so I'm gonna test external rotation. Hold your leg here. Do not let me move. I'm gonna go here. Pull your hamstring back. Do not let me pull. Get the quality or sense of how is the interaction. I go here. Lift your leg up here. Do not let me push. Do not let me push. Bend your knee. Pull back. Do not let me pull. And you're gonna notice. In this, can I hold on? Yeah. Hold right on. Go ahead. Hold on. Pull. No. Yeah. Go ahead. Lift up. It's not going to change the fact. And then go here. The same thing. What I described is when you're looking for that, you might get a 5 out of 5. It's not a 5 out of 5 if it takes me 2 inches or an inch to pull, right? So the power, go ahead and hold on. It's that initial, you don't have that reaction time, right? So let's try something. Push that knee forward. Okay, now what Derek was just talking about, right? See the crease here. I'm pre-positioning you into left AFIR. I lift your leg up here. Now I have good strength, right? So a patient goes, holy crap, what's that? Right. And then that same thing, hamstring here, right? I just say you shouldn't have to do that, right? But if you lift something heavy, 30 pounds, I lift it up, it's heavy, especially for me. Put a 30-pound dumbbell there. I can't curl that, that's awful, right? My biceps not in a good position to work. Because of our imbalances, those muscles aren't ready to work yet, right? Hands forward, do not let me push. Okay, do not let me push. Shift this knee forward. Reach that arm forward. Do not let me push. I've changed your thorax position enough so that your right shoulder blade drops a little bit. Now the right shoulder blade is playing a little bit better with that rib cage. Now all those muscles, serratus anterior, rhomboids, lower trap, mid trap, have a better approximation of moving, right? Yeah. And so and then if you lie prone, bend your knee, lift your leg up, don't let me push. Bend the knee, lift your leg up, don't let me push. Okay, now if I go shorten this leg, bend this knee, lift your leg up, don't let me push. I've changed your position of your pelvis, your right glute max inactivate. So when you're having those, so sit up for a second. So all those things are things you test.
Right.
All you're doing is repositioning and say, is this a true weakness in the muscle, or is it a link-tension relationship problem and they're not able to fire?
Yeah, they're out of
so
position.
so patients kind of catch that, like, oh, well, you know what I mean? So those are the things I use, and they're not necessarily PRI tests. I just find as I use them, a patient. Like I have some patients that can't even lift their leg off the table in extension.
Right.
Now, is that because of back over firing? Because sometimes I'll look at quality. I'll look at is it lifting with using your parameter T rules, is what a tons of things to do. But it gives you a starting point of okay. And the thought is, if I get the inhibitory, I get your positioning better. All of us, I shouldn't have to reposition to get those to fire.
Right.
And so I said, you know what? You're not even firing that. Can you imagine when you're running for thousands of steps for an hour? If that thing's going to shut off, it's going to be completely off. But you're still propelling yourself against gravity.
Right.
Right? So we still got to get there somehow. So that might mean your TFL's turned on. That might mean this is why my lower Achilles hurts. This is because
It's actually jacked up right now.
yeah. So because your plantar flexors are, and you're more of a 4-foot runner anyways.
Yep.
I ran just the time we run together. So those are jacked up. It's like, okay, it's not horrible to do that. Problem is when you're done running, they're still running.
Yep.
And so we just do.
So usually I test right side first because that's usually the side that we may see be negative. So what we're going to do here, I like to just kind of give some range of motion here just to help the patient relax. I am stabilizing their innominate here on the top end, bringing them up and over, and usually this is a problem, just range of motion wise. But then we're just going to drop that leg, make sure they're squared up here, and feel that tension?
Yeah.
Where do you feel it? Yeah, right through your
So
hip
Kevin,
bone.
that's a quote unquote Ober test, right?
Right. Yep.
Right.
But the way they describe it is it's really looking at the kinematics of your relationship of your innominate and your femur.
Okay.
Right.
So if you're open up a little bit on that side, or if your bell is forward on both sides, that's when it gets both. The femoral head gets caught up in the acetabulum rim.
Yep.
But you're not too inflexible, but there are some people that I can't even get. I mean, we can't even get to midline because their psoas are so, and they'll try to do everything to get there. But so like sometimes if I can't get them to it's a positive test. I'm not even. And if it isn't, then the anterior ligament is gone.
Right, they blew out the front.
As soon as that bottom leg starts to slide, it's positive.
Yeah.
too.
For
Right,
sure.
yeah, it's just like, and then you don't want to be like, yeah, hold on, we're going to try to get it. No, it's just stop.
It's just not good. Yeah.
Let's get you flipped over the other side. I want you to feel the other side.
Because technically, unless someone's got really pathology,
You
you
might
do the
have a
right thing.
chance.
It's positive. You don't even need to drop.
But just relax.
Yeah, exactly.
So we're going to bring you up and over. And just give it a second. I'm dropping a little bit, but still a positive test. Okay. So I would say you're forward on both sides, right?
Yep.
Let's just get you on your back real quick, just because I'm curious. I want to see where you're at here.
It's junk. I know that.
Oh yeah, just relax.
He will probably be one where you'll probably clear out.
Right, so you're positive there, which we're going to see a lot more positives on the right because the gauge rolls that. On the left has a hard thing. I can see your left.
I
We can, like, we're going to put a little flagpole on
Yep.
there, get a nice high. You were flared out on that left side. I'm kind of pushing down towards the head of the bed. And positive on both. So you're PEC, right?
Yep.
You're up both, forward both.
Yep.
Right. So where we'd start on you is just try to get the ribs to drop.
Get down. Yep.
Hip it there. Might give you a 90-90 hip lift to just start
Why
working
don't
on that
we,
pelvis as well.
Why don't we do, why don't you see if he clears out
Yeah.
anything? Just show him hook line. You don't have to use a book underneath.
Okay,
the
yeah,
speakers on. Just
Yeah.
OITA.
Okay.
Have him go through a sequence of 4 or 5. Recheck his HDIR.
Yeah.
Recheck side and just see if there's any change with that. You're kind of semi-PEC right now, but is that really a PEC or just we can clear that up quicker and get to the underlying issue? Because sometimes that will happen.
All right. Have you done any PRO before? Like, been a patient?
No.
Okay. All right. I just want to get a sense of where we're at. But so generally, I talk to patients about like first we got to ground you through the ground, right? We got to start somewhere. So what I want you to do is kind of just gently push down through your feet, like maybe like a 3 or 4 out of 10, just enough to turn on hamstrings. Right? I'm just cueing and just trying to feel for that hamstring. Maybe a little bit more push down, sense that heel on both sides. Good. So turn on your hamstrings. We're going to use that hamstring tension in the patient's tailbones, right? And just now give me a little bit of a tuck, right? Just to flatten out your back. That's great. I get a piece of paper on it. Perfect. I want you to hold this. I want you to breathe in through your nose. Then I want you to breathe out through your mouth. Purse your lips like you're blowing on soup to cool it down. Right? And we just keep going. Go, 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 go. More.
See a good Hemi activation right now?
I tested, yeah. Well, right now, let's see. Keep that. Yep.
Pretty good.
We're good.
Pretty good. Oh.
And now, breathe in through your nose and breathe out through your mouth all the way. Go. 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 Go, 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 go. Drop, drop. At some point, you're going to probably already felt it in those ribs. There we go. There's the drop. Now hold it. Put the tongue on the roof of your mouth and hold it for at least 3 seconds.
Have them do this.
Yeah.
So you get a feel.
And keep that tongue on the roof of your mouth. Breathe in through your nose. Here. Now you're not pushing, just feeling. Okay. Breathe in and breathe out. Breathe out again. All the way. All the way. And that drop we talked about, you should feel it with your hands too. It's just another way of kind of feeling feedback to get your ribs to drop down. All the way down. Go, 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 go. Hold tongue roof of your mouth. That tongue on the roof of your mouth is going to help your pelvic floor relax, right? And we're trying to get your diaphragm to relax by getting your ribs all the way down, and your diaphragm and your pelvic floor are both diaphragms, and they kind of work together. So we need that pelvic floor to kind of relax as well. So that's why we're doing that tongue on the roof of your mouth, and it also just helps direct here. So breathe in and breathe out one more time. Go for it. Good. Keeping your head relaxed. A lot of people want to do a crunch for some reason. Breathe out, breathe out, breathe out, breathe out, breathe out, breathe out. Go, go, go. Hold. You're like, I can't. Okay. Relax. Relax your legs. Relax everything. So generally we do like 5 sets of 5.
Okay.
Sometimes 4 if you're like, I don't have time for that. So 4 or 5. Rest. A lot of patients are like, all right, 5 times 5 is 25. I'm going to breathe 25 times. Right. It's like, no, you need to kind of reset, give some stuff to, and a lot of times we get people doing this and they're cramping in their back, they're cramping in the rib cage, and they're getting hamstring cramps because those things aren't used to elongating or being used.
Sure.
Right? So, you know, push down again, 3 or 4 out of 5, or out of 10. Feel your heels. Good. I want you to feel those hamstrings. Good. Hamstring tension. Tuck. Get that low back flat. Breathe in through your nose. And breathe out through your mouth all the way. Go. Good. Go, 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 go. Good. Tongue roof of your mouth. Hold it. 3 seconds. I believe in you. And breathe in. And breathe out. All the way. Good. Good. Go, go, go. Good. Excellent. Breathe in. 2 more exhales and then relax. Sometimes just kind of mentally check into what's going on down here. Okay? Just keeping it like a mental inventory, but really center stage is getting that air out, holding it out for at least 3 seconds. Relax everything. Good, that's 2 sets. Okay, let's see what we got so far. I do this to just kind of give people that like cue of loose up. It's better.
A little bit better.
You're not cleared, but that was the right side, so maybe this side's really cleared out. Just
The way
relax.
he was presenting, I would want to get his left abdomen and left hamstring kicking more, so I would do
Better.
there was forget, right?
Okay, 2 more sets of 5. Small. And that doesn't have to be huge, right? If I can get my hand underneath here, you're going too far.
Too far.
Yep. 99% of the time, I'm telling people to do less, right? They're like, he told me to get my, I'm gonna, you know what I mean?
Yep.
This is not a Hulk Hogan, Randy Savage moment, right? This is just relax, small tilt, free. A lot of times, you know, patients after doing something like this, I said, I felt more relaxed.
Yeah.
You know, their symptoms might change a little bit, but after I have them walk, how do you feel? Like, I feel loose. I feel relaxed. And I kind of give that information to them, like, well, you just kind of got out of that fight or flight and kind of went into the standby or calm mode, right? And you live in that fight or flight mode. They're like, yeah, you know what I do? I'm really stressed. I'm like, yeah, stress and your limbic system freaking out is definitely factoring into some of this. Just watch this. Sometimes you just get a little wound because you're thinking about, yeah, get over there, and then that starts to overly tilt, over. One more set of 5.
So
Good. Try to relax your toes. See how you're starting to you're getting really wound.
That's perfect. Well, when you order them, and then
Good.
that's awesome. And we have
So this is
them
just
all-
points to check in with once in a while. It's
which
like, am I
highly
getting a
recommend
little
for every client.
Yeah, I can feel it too. I don't know.
yeah? And so sometimes if you're like, I just can't stop,
The punching.
right, and just reset. And reset coming from a place of like, I just need to do this gently. Generally with patients, I'm like, oh, you're an A+ student. You wanna. I'm asking you to do something, and you want to go above and beyond. So you're getting to that A+. So it's kind of giving a positive bend to a correction. So patients appreciate that kind of stuff. So you're an A+ student. You're a great student. It's just you're going too far. I'm not shooting for A+ right now. Good. Relax. A little positive there. Just relax. You're like, I'm being tested. It's gotta go down. So we're still a little bit clearing out, right? So, mind if I do a left AIC to get him down? He's almost there.
Drop. Take his. Look at his age. Drops.
Let's get you on your
And then have
left
walk
side.
and see what it feels like. Get at. And
Yep.
you'll get a lot. And sometimes if someone's really symptomatic, I might put their feet up on something, or up on a chair, or.
Woo.
Yes.
Down he goes.
Yes. So that's what he said.
Good. You're
Yeah.
still
He was still-
positive, but that's better.
And I would say that's pretty. I would be with Nancy. And I would say, well, I probably with
It's
this person,
change.
I go right into left AFIR stuff, left AIC stuff.
Okay.
You know what I mean? I would probably have them do something to get ZOA, but I
Yeah.
would think I could probably do a 99 with a shift. I could probably do a scissor slide, and probably because you might see even more clear up, because that's a pretty significant for not doing really manual stuff and him doing it himself.
Right.
Did you feel the difference, Kevin?
Yeah, oh, definitely.
Switch sides. Let's see what that other side looks like. That drop sometimes. How does the quality feel when you get back? That's not bad.
Better.
He's
Yeah,
compensating.
but
He's extending a lot through his spine.
yeah.
And Derek
So-
has big hands.
See that.
And he can get away with holding onto someone's leg that way. I always come underneath and can hold on to
Cradle
the
the baby.
baby.
Kevin,
So just a different hand size, and so I come this way, and then I just relax right into my hand, and then I can pop him back this way. That way, I can handle a leg easier that way than Derek can.
I'd be more inclined in getting him into like a short step respiration or something to just like,
Yeah, so
or a
incorporate
child's pose.
Yeah, something incorporating paravertebral integration with a little bit of hamstring. So you could also accomplish that with a 90-90.
Yeah.
But I would be the same thing. So I might get him because something's easy, either because we would look at full functional squat holding on, or if they call it squatting bar reach, you know what I mean, holding on something,
Right.
a stair, to incorporate that as well.
Good.
But I would be inclined to probably on first visit, Kevin, I would start with someone like you, like Nancy said, I'd probably already start into getting left AFIR, because you may, but you cannot, you gotta be able to get someone to get ZOA and breathing, so that's something you do. And don't give them more than 3 or 4 activities to do.
Yeah.
Yep.
Yeah. And the way I kind of play it is I try to give them 2 exercises where they're on their back and there's some setup. like a 90-90 and maybe like a bar reach. And then I try to give them something seated or something portable that they can do throughout the day.
Okay.
But they have, like, I'm just like, you have to do these two that are some setups, like getting in the habit of setting some time aside for yourself and be an adult and
Sure.
prioritize. But also something that you can do during the day.
Okay.
Yeah, and it would be more of a reference point for the heel standing. So sometimes I would give you a standing passive, a standing left AFR, passive left hip approximation. So standing there, if you have good kinematic awareness and control, I might give you the abduction, I may not. I may sometimes do, if you're really tight in the posterior capsule, I may give you a respiratory. I like the respiratory, the movement, because some people feel like
The
you're doing
scissor
something.
slides?
No, the standing.
Oh, yeah.
But that also gives you neurological awareness of your left side, but also some capsule movement. Those type of things.
Yeah. I don't typically go to that real quick. Someone like you, I might, because you're,
Right.
a little bit more
But
not as jacked.
something in what I would think in this situation too. So I always give something that starts in activity they can do at their workstation, do during the day. That's going to get them standing awareness of their left heel and incorporate breathing. So whatever we use, that would be it.
Right.
And then that would be. So I say I'm going to give you 2 laying down exercises, a sitting one and standing one. A lot of times, like that one is a great one to get.
It's been sitting too high for too long.
Yeah. Can we look at a standing functional squat forwards?
Sure.
I just
Wanna-
want to
So, put your feet together. Maybe apart just a little bit. Let me back away from the table. I want you to squat down and then come back.
I wish I had his.
Flanagan's. Yeah.
Okay, try to go again.
He knows.
Don't use that as an excuse in August when I'm kicking your butt.
And put your right hand over your left.
I'll do that. All right.
And now touch your left foot. What do you feel there?
So
Hamstrings. Yeah, come up.
His back.
Yeah,
Yeah.
switch.
Right, and he can still
He
reach,
can't
right?
squat.
Down.
So yes, and so he's.
And then come back.
Can you do a straight leg raise hamstring? Because I know, guarantee he's over 90. He's
Yeah.
got to be 110.
We don't have to see if he's
But-
fat though.
Yeah, the anterior compartment.
Yeah.
So this is so
Feel
when
it
we
there?
look at that together. So he's a patho PC, left ASC, whatever. But so
So we're
this
just
is
checking
why
out your hamstring,
I would want
right?
him to do some.
If you were like
inappropriate because he
over
needs to
here,
shorten
it's like,
those
oh,
hamstrings.
shoot.
Right?
You
So
don't have a
he
hamstring.
can't giving him something to find his ZOA that activates his hamstrings because he's overlinked on both sides and he needs to start learning how to activate that. Does that make sense?
Right.
Because this is great and it can be a one thing you can accomplish or sitting and it does put it, but he's going to really need to learn how to capture those hamstrings. So the supine hamstring, or you could just simply go to a 90-90 and focus a little more left hamstrings, but he needs that control because the normal hamstring length, Kevin, that we look at is because unless you're a yogiite and they come flat palm, but your compensation is you've overlinked your hamstrings to get there. You should be
Yep.
able to functionally squat.
Right.
And 70 to 90 is normal,
Right. Somewhere in there.
somewhere in there, and you're past that. So think of a stretched out rubber band,
Yep.
right? So
Yep.
you need control of those hamstrings to control the ischial tuberosity
Sure.
and thinking of why are the hamstrings way more important than the quads? Well, the hamstrings do more planes of movement because of both sides, rotational. They'll do pelvic positioning and stuff like that. So that's where I would say it's like, okay, let's cut to the chase. I need to get a ZOA. We need to find something, but also we should start a little bit hamstring activation with him as a focus to help get him there to start that process.
Okay, let's get you down the mat. I want to get you into 90-90. So how I instruct it. Sometimes I'll put a box over here if they have socks on and then their shoes are kind of gross or whatever. Or I'll tell them, hey, you do this barefoot at home because you can get some grip on the wall. But you have shoes on, so great. But I'm still going to say, what I want you to do is I want you to push down into this imaginary shelf I'm putting underneath your feet. Right? So I want you to push down as if you're trying to bend your knees. Right? What do you feel? Hamstrings. Right? I want you to feel those hamstrings throughout this. Right? That's the whole purpose of doing that is to activate those hamstrings. And just like that last exercise, I want those hamstrings. Let's push down through here. Push down through here. Good. Just like the other exercise, those hamstrings are going to perform the tilt. This is not an abdominal exercise. This is more of a hamstring activation to get your pelvis more neutral, right? So we're gonna start here. I want you to just hold this position, breathe in through your nose, and breathe out through your mouth. All the way out. All the way out. Good, 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 good. I'm just gonna help that left side get down. Good. And breathe in. And breathe out. All the way. Go.
Is his adductor kicked in and his...
So I'm teaching him the 90-90,
Yep.
right?
Yeah.
Just to get the ball under, kind of, the first time doing a 90-90. Right? Right. Where I'm going with this is
But he's already, it's good. He's already, even
We're
with,
starting someplace and we're jumping 3 steps
but
ahead.
Right.
he's
So I
already,
feel you. I'm going there.
he's actually got more left hamstring, so already. So
Right.
you're
Right.
which is good.
Right.
And that's the weird thing about a straight 90-90. Even the straight 90-90 directions without a shift say you should feel your left hamstring. That doesn't always happen. But
Right. So
I like to cue sometimes too for people that don't like. You have good kinesthetic awareness, but it's like, okay, is it there?
Yep.
So sometimes I'll have them
yeah,
put their hand
checks.
there.
Yep. But I'll always try to direct them to there here. Right. This is center stage. Do some check-ins here.
Backseat driver,
Sure.
Nancy.
Right.
I know.
Yeah. Do some
I
check-ins.
know.
So you've got the mechanics of this. So like you know, if you're a patient, I'd still say maybe let's do through 3 sets just to get them
Right.
like
Think
aware
about
of
it, yeah.
what this is and what that is. So then I say, all right, we're gonna progress this a little bit, and we're gonna. What I want you to do is give me that 90-90, which you already got. What I want you to do is take this thigh, go up, and that thigh go down. So you're rolling that ball towards me, right? And so what do you feel here?
Where?
You feel more activation left or right?
Left. I feel like.
Left, right? Do you feel any muscle activation in here too?
Yep.
Good. So you're gonna hold that. Right arm goes up, and it's up towards the ceiling. Then you're gonna breathe in through your nose, and now when you breathe out through your mouth, pursed lips, you're just gonna reach, reach, reach. Now this is helping your left come down, right? So we're putting it into your left rib cage, your left ZOA, and your left hip. We're taking that femur and putting it into the acetabulum, right? We're getting you out of the right side, and we're getting your left hamstring and left adductor to fire, which are 2 of the 3 ingredients we need to kind of get into that left AFIR. So breathing out, breathe out all the way, good, reach. Now on the breath in, hold the height, don't come down. And you might feel some expansion into here, okay? Which is expanding that right chest cavity, which we want to do because we want to not be expanding in here, right? And breathe out all the way. Good. Good. Might want to shift just a little bit more. Hard, isn't it? And a lot of people just can't shift, right? And
I feel like I'm going into my toes on this.
you're going into your toes, you
Yeah.
drop down, right? And so that's good awareness. And just reset. Good. Try to get 5 breaths in here. Yeah, there's a lot of stuff being done, kind of bell down, bowl
Right.
under, getting into the left side, all at once.
Yep.
Right?
Do we care if toes are up, out?
I was gonna say, I feel like I'm turning.
rotated?
Yeah,
Out
yeah. You
here,
want
out.
to check in with that. If you feel like you're rotating, that's your
Reset.
compensation creeping in.
Yep.
Right. That's external rotation starting to happen into your right side, which is kind of where you tend to be. Let's just say I can't get a shift. Right. The shift is just not happening, and I just can't do that. Then I'm looking more further up in the frontal plane. Or, I'll get them into that passive IR and just work on some of this, so they can get that roll under, and maybe, or just do a 90-90 with left externally rotated, just to get that medial hamstring on the left side. Another thing I could do, right? If you're like, man, I can't feel this. I don't feel it. I feel this. I don't feel this. Is just
He's got good pull off the wall.
He
right.
does.
And so do a 90-90. Still push down into the shit. Pull down into here.
Show him this
Right.
too.
Feel that?
Mhm.
Kind of
This
kick
is
on a
a
little more.
great tool. This is a great tool if you have someone that can't get there.
I think they have the big foam box there in Yarmouth too.
Do they?
Yeah.
I had
This
some
isn't my-
in the box for us.
I like the box for us because we have different heights we can use.
Oh,
Like,
yeah,
I would
I
use
saw-
the higher.
Yeah, I saw those. I saw
I would use the longer orientation. So push down into that, like fires.
Yep.
Right. But I tell people this is training wheels. Like don't just like
to get.
don't go to your coffee table and just
dig
bear
in.
down on your
Yeah.
coffee table because your feet need to be flat against something for this to really mean something to your brain.
Got
which
it.
is the whole point, right? So that you'll feel the difference there. So this is good to kind of get training wheels to get someone to turn on their hamstrings.
Sure.
A lot of times people are digging into their toes and their quads are on fire. It's like no, this is like completely wrong. We need to do something to kind of get that click.
Sure.
And it's just a click. Like once people go, oh, now they
Then take it away. Yeah.
right. Don't put too much pressure on.
Come on, here it goes. I want to see a squat is what I want to see. Look at, that's his right, okay.
Right. Yeah.
Looks good.
But that's good. That's the best one on the right side he's had. Each on the other side.
And typically, Derek, with your patients, you test and retest before and after, then they see the difference too.
Right. It's
Wow.
yeah. Good. Look at that. Great. Let's get you on your back. We can hit your patients.
Trying to help. Yeah.
Yeah. Good. That's better. That's probably your best internal rotation test on that side that you've had. And just rest. Good. I mean, I have to kind of push it down a little bit, but that's a lot better,
Feels better.
right? So that's good. So you're a lot closer to being neutral than you were, 25 minutes ago.
Yeah.
Right. And you really didn't do a whole lot.
Right. Right.
Just a lot of breathing and positioning. Right.
And think of it too, Kevin. You're less asymmetrical. You're never
Yep.
going to be. You're
Right.
You're less asymmetrical.
Right.
Get up, walk around. Just gonna see what it feels like. No. Stand on your right side.
Yeah, still comfortable.
See what I mean?
Yeah.
So I get getting back is so that's where tuck your tail underneath you. So with looking at that, just him standing right side and then switch sides, he's got a little shear on both sides.
Yeah.
So in my mind is going to go. That's why we need
Half up.
hamstrings
Yeah.
on both sides
Yeah. Yeah.
because we need to get that control. But we need to work on. You need to work on the different planes of movement, like getting in this way. But we need that kind of that frontal and transverse piece.
Right. But it initially learning PRI,
So
it's like
Right.
Hold it, yeah.
just get under,
Get underneath.
and get down.
Because you're not going to do. So if you're not going to do anything, you'll make positive gains with most everybody if they start learning that piece, and you'll be fine if you start getting them to the left hip too. It's just sometimes harder to truly get that shift if we're so extended. And you're not. You just have the way your body is.
Tendency to-
Yeah, and overlengthened hamstrings and kind of, so when you're going here, where you're not really kind of sinking into that hip even on the right side.
Yeah,
So I kind of open up through those. So that's where we're getting that hamstring activated.
squat, sir. Good. That was deeper. Can
It
you get all the way
feels,
down?
yeah, felt easier.
Yeah.
Right.
Can you get all the way down? Feel the ground through your heels.
Yeah.
Almost fell
You're
back
getting
there.
some flexion in your lumbar spine when you're squatting now.
Turn this way.
Yeah.
Turn this way and grab a hold. Just put your fingertips on those two things when you face. No, face that
Wait,
way. You're gonna squat. You're gonna hold on to those two little bars with your fingers.
Then both hands.
Yeah, both hands. We'll hold around and get into squat. There you go. That's all. That's stability.
Yeah.
You just found a grounded space and get down there. You have the range of motion. Someone like, I can't get there because I'm tight, and then you put them on their back and they got knee to chest. You know what I mean?
Right.
Right.
So, like Nancy was saying, you're less extended in your thoracic spine. You're getting a little bit more forward. You're allowing your bell to get down, so it allows your pole to get under, so that you can get into a deeper squat and back up.
Right.
When I started this journey a long time ago, I literally was like, okay, can't get there. When I did this, the first thing I tried to work on was sit in front of the couch and sit all the way down. I literally lasted 30 seconds. I thought my kneecaps were going to fly right out. So tight.
Yeah, I felt.
And so then I just worked on
in here.
sitting longer and sitting longer. And I still can't, I don't have I still can't get all the way down without feeling like there. But it's you just have a like I can go when I go like this. It's like I'm cool. I'm good.
Right.
You know.
So
What would be your what are your kind of go-to exercises after we get this?
just learning bell down, pull under, like standing against the wall.
Like bilaterally, or are you talking
Yeah,
standing
well,
left hand?
I would be more trying to get him
Left.
into his left side.
So why don't we
I
do?
like the
Is-
left pull down, left grounding pull down.
Oh yeah.
Because that integrates so
Can you-
much,
so
but
let's do
it's
this.
complex.
Why don't you teach him?
You're gonna be standing with your left leg back, right leg forward, feel the left heel on the ground, and then just take the mound of your big toe, make sure it's touching the ground. Then take a breath in. As you exhale, you're gonna get that rib cage down just like you did when you were doing your 90-90 hip lift. Then, as you pull down with your left arm, you're gonna squat a little bit and reach forward, round your back, reach and breathe. In through your nose, out through your mouth. As you exhale, you'll get more rounding. And then take an easy breath in. Big breath out. Pull back and reach. So first, just get your legs in position. Grab onto that. Left heel. Round through. Take a moment to breathe. Exhale, round through here. Drop this down. Do you feel your right big toe bound?
Yep.
And then ground a little bit more. He's still in a lot of extension. Drop this underneath.
Grip and rip.
Okay, now pull down, reach forward, exhale the air.
You don't like that, Kevin, do you? Holy moly!
Feels wrong.
I think I'd have him sitting before I do this.
Let's stand up for a second. Sorry to pick on you, bud.
No.
Yeah,
I need it.
Look at this. Look at this. Look at this right. Feel this right track.
Yeah.
Right lat. Feel
Once
this
I-
right lat compared to his left.
Yeah, once I got him here,
I can see it from
once
here.
I got him
Yeah.
here, like wrong exercise
So,
for Kevin right
See the
now.
difference?
Yeah.
Do you
So-
Like Michael Phelps over
do you have a
here.
difference
Yeah.
in your back?
Yeah, yeah, I can see the difference.
Definitely. So it's you
Yeah,
look
right step.
different, right? They're
Yeah.
just different.
Yeah.
Yeah. Yeah.
So I probably would have figured this out earlier and got him into a seated bar read.
Walk me
Pull
through.
down.
Yes.
What? Yeah, because I want to hear like how you cue. You know what I mean?
Yeah.
So let me do it.
I've got it.
I'm not.
Yeah,
I'm
you
not as
feel
jacked.
great after this.
I have no muscle. You have muscle.
Okay, so left hand, left leg back a little bit. Your shoes untied.
Yeah. Palm up.
Palm down. Feel your left heel. Feel your right big toe mound. Perfect. You're going to inhale through your nose. As you exhale, drop that rib cage down. Don't do anything with the band yet. Now, second one, you're going to pull down with the band, reach, and then get into a little bit of a squat. There you go. Reach forward with this arm now. So get all the air out. Good. Breathe in.
Sure.
Exhale all the air out. Drop down. Keep pulling. There you go. Perfect. Stay there for 3 more breaths.
I think.
Doing okay on that left side, Greg?
Oh yeah.
Okay.
It's working.
So he's got some good
like-
rounding. He's getting the reaching. He's getting the pulling. He's in his left heel, I hope.
Yep.
Yeah.
But I have.
He's shaking a bit.
Oh yes.
You know what I mean?
That was my
And it's
concern. in the
really
beginning,
pulling
trying
that
to
left
go,
rib cage down.
And so
Yeah,
what's
but-
happened to me is I've gone in the reverse direction. So I've worked so hard because I used to be up that when I went to see Michael Mullen, my posterior medius diaphragm cannot stretch anymore. I am at its wit's end, but it still feels like I need to stretch. He said, "You're not getting anywhere because I'm not expanding this way. I'm expanding this way." So on my I was trying to do the all 4 posterior medius. It's like feels like I need to stretch. He said, "Greg, you don't have anywhere to go." It's like so it's your end fascial range.
Right.
So it is. But yeah, just finding that position. So like right now you're standing, you're not in left AFIR.
That's the one with the hands on the table, the book under the left leg. Is it the book under the left leg? Right
Yeah,
leg
gotcha.
hands out.
Yeah.
Can
That
you walk
one,
him?
but he needs to be more grounded.
Yep.
So
Yeah.
that might be a good
I'm gonna
place
let me
for him.
demonstrate passive and that'll demonstrate abduction.
Active.
Come on over. So I'm gonna do standing left AFIR. There are, what I'm gonna first show him is passive, which is 50-50 weight on both sides. And then I'm gonna show him left AFI, standing supported left AFIR with right abduction. Okay. So this one first works on you just getting where. So book 2x4. If you're, what also I have sometimes people do is take a shoe off, but you keep the shoe on. Okay, keep your, you know what I mean, if you have thumbnails. So you're gonna stand, hands are on the table, slightly around the back. It'll be tough for you to get there. Okay, your feet are close together. Okay, and all I'm gonna have you do, breathe in through your nose, and as I breathe out, I am straightening out my knees. The tough part here, all I want you, and so I walk you through, I don't get too detailed. Hands on the table, around your back, straighten out both knees. I want you to find 50-50 weight bearing on both sides. That's going to be hard to do, right? So sometimes I don't over cue. Sometimes I don't over cue. And so it tells you to side bend to this side a little bit.
Makes sense.
But they don't really need to, right? So now what you're going to do here, breathe into your nose, breathe out your mouth. He needs push your knees down.
Yeah.
Both.
Yeah.
Breathe in. So that's okay. Do you feel how tight that is right there? Breathe out. So feel my hand. When you breathe in, I should be able to breathe into here, right? Breathe in. That's better. Feel it open. Good. And then you come on. Now put your hand on my back. Inhalation. Do you feel loose?
Yep.
Expand a little bit?
Yep.
Don't fight to do it. Because it's just your neck, just your
Let it happen.
Just kind of go, and it will get better. So this is a standing supported left hip approximation.
So much better.
Okay.
Okay.
Watch too much House.
Razor.
So feel
House of
good.
Fraser, and they messed it up.
Breathe in through your nose. Come on over. What we're gonna do? You're gonna stand, hands on the table, and then I just want you to push your foot up to the side. So I've gotten away from getting too detailed, just because it confuses some people.
Yeah.
So
this is
just
a hard one to teach. if
So
you're
just
too
all
late.
you're gonna have to do is put your foot up to the side and find your inner arch here. Right there, all the way over. Good. Now I'm gonna do a couple things. What you're gonna do is you're gonna just come over that side a little bit, tuck your tailbone a little bit. Good. Relax your shoulders. Relax. Thank you. Stay rounded, but relax. Bring the shoulder.
Not a push up.
There you go. Pressure through mostly left heel to midfoot.
Yep.
How's that feeling?
Okay.
Hold there.
Fighting to stay there.
Breathe in through your nose. Breathe in out your mouth. Hold that hand. That way. Breathe in. Exhale, breathe out. When you get the arrow, you'll actually feel those muscles engage even more. Yeah, he's working. Kind of progression of it. You have contact, 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 contact. So your body is not going to feel like it needs this as much to stay stable. Now, you're learning to turn switches on here, switches off here. On this last breath, Kevin, breathe in. As I exhale, that loads you up through. We're turning this switch on, turning this off. If I go through 5 breaths and the first thing I do is this, whoop, we kind of lose a little bit. So yep. Just put your foot up to the side, find the inside arch. Find your left heel, so put pressure through heel to midfoot. Look down here. We want to see a crease in those pants. Tuck under more. Good. Kinesthetic awareness. So it's
Right. Yeah. It's so easy. It's like with patients, but in the real world, just getting the bull under is the hardest part about this exercise.
And so they may need to go forwards. Because that puts you down a little bit more.
Right.
You know what I mean?
I tend to want to just get to standing bilateral twisting.
I have a patient yesterday that could not get back into the wall. It hurt too much, couldn't do it.
Yeah.
So I switched. So some people are good like that, but they can't get there. Oh, whoa, whoa, and then so they had to get down here. I used the Eric's pad. Let's try that. Now just focus here and try to work on that. But this person really needs this exercise.
Yeah.
But they just,
can't
you know, because
get
it's
there.
their body's going. My back's not even. You can drive a small car underneath there, right?
Yeah.
So.
I'll put an Eric's pad behind their back.
Yep.
So sometimes it's just their spine on the wall.
What's this one called?
This one here,
Yeah.
standing, supported, left AFIR with right FA abduction. It's under right abduction, adduction inhibition. Yep. It's one of my. This is one of my the go-tos, and the progressions are one hand drop, foot off. The more higher you go up.
Yeah,
Try
this.
one more.
I mean, this is hard to get. That's
But-
why I tend to shy. I sometimes
tend to
shy away.
from it just for
Because
that
it's like,
reason, but it's such
But,
a powerful one.
don't shy away from it, and just try to keep it simpler. Just saying, hey, just get over this stuff.
Yeah,
Because right now,
the
if I
frustration level with
Okay.
patients tends to like bubble over real quick with this, because this is like their quads are on fire and they just.
yeah,
You
and just
know.
say that's good. That's what you want. You know.
Or
If you
the-
have someone that's deconditioned, it's definitely harder.
Yeah.
But even if you have an athlete that's a runner, once you get in this position, they get shaky pretty quickly because you're
Right.
using.
A runner, great. You know, Stiff Stu, who's 75. This is.
But then
Yeah.
with stiff stew, just go about 3 or 4, 6 inches out to the side and just stand there.
Okay. Yeah.
You know what I mean?
Yeah.
Just get.
I tend to have just Stiff Stu working here.
But
and-
it's it's okay to say, okay, well just rest your inside of your foot, and don't worry too much about. You're starting the process of changing.
Yeah,
You know what
right,
I mean?
right.
That's what I said. I do the same thing. I'm like, I'm just trying to get away from over instructing and just try to get that a little
Right.
easier.
Right.
Hey, what are you shaking for there, bud?
There you
Walk around, see what that feels like, then do the squat again.
go.
Go ahead and squat, see what that feels like. All right.
Good. Put your legs all the way together. Together. Yeah, like together more. More. Go. I'll humble you a little bit, but yeah, not bad. Better than it was before.
Calf inhibition.
I'm just gonna show you first. So it's ribs down, tail under. Breathe in. Keeping my pelvis down and under. Breathe in. Staying grounded through my heels the whole time. And trying to keep this down and under.
Okay.
Right? So breathing out as I go down.
And you may not be able to do that without compensation. So when you do a squatting bar reach or something, that gives you more stability. Hands down more towards I can't
Are feet supposed to be together?
close.
Yeah.
But any kind of movement change is good. You know.
Okay.
Breathe in. Breathe out as you go down. Try to stay under. Keep
Yeah,
right. So I wouldn't start there.
Yeah.
But I mean, just going over here and
Just a little bit of holding on is
And
going to
doing-
allow you to get a lot better.
So,
Yes,
kind of doing the same
that
thing.
changes.
Legs down, tail
Oh
tucked.
no, we don't want to lift from the heels.
And
That's
then
gonna push your
now I'm
toes.
kind
One
of
edge
the
to the
same
other
thing
way.
you did.
So when we
But
do
now
a
I got
reverse,
this.
it's actually toes up.
Oh,
So
okay,
this is
okay.
another
Stay down.
plantar flexion inhibition. You're on a step and you're lifting up like this
Okay,
with a ball.
okay.
Because
Stay
you're
down
getting the
here.
anterior tib fired, which shuts off the back one.
Because you feel like you're
I'm
gonna
not-
fall back,
I'm
but then you
not
go into extension and
Right,
nope.
right.
Right. Your body goes nope. Save myself. So breathe in.
We're gonna wrap up here
Breathe
really
out.
soon anyway.
Yeah.
So,
Good. Breathe in.
Spring, we all have tight schedules.
Breathe out.
Yeah.
All the way down.
Well, Nancy, you guys are doing awesome. I appreciate everything you're doing. You guys have made some super changes, and you guys are getting